My name is Madison Reese, and today I will be providing a summary of the current portfolio of interventional clinical trials regarding knee injuries. Clinical trials are the gold standard of evidence-based medicine. All trials now have to be registered at clinicaltrials.gov so the public can view them. We wanted to look at current trials regarding knee injuries due to the increasing participation in youth sports amongst kids. Sustaining knee injuries at young ages can affect your quality of life as you get older, leading to conditions like osteoarthritis. This study was to create a summary of the current interventional knee injury clinical trial portfolio. To find eligible trials, we ran a search on clinicaltrials.gov specifying a multitude of possible injuries as well as any possible associated abbreviations. We limited our search to trials that were registered after October of 2021 until the present day. We also only included trials that were labeled interventional. Trials had to focus on knee injuries as well. This process is illustrated on the next slide. Once trials were selected for inclusion, they were analyzed by intervention type, enrollment population, trial phase, location, and injury type. Upon initial search, our string produced 451 clinical trials. 290 trials were excluded in a mass duplicative screening process by 2 authors. 288 of these were excluded for not being a knee injury, and 2 were not considered interventional. This left 161 trials to be included in the study. 161 trials included in the study. We categorized them in a variety of ways. The first being intervention type. The most common intervention was actually labeled as other. This included new diagnostic tests and rehabilitation programs. The next most common intervention type were new surgical procedures. We also looked at enrollment populations. The average enrollment was 100 people. There were only 3 trials that looked at pediatric interventions, leaving the majority of them to include some form of adult enrollment. The majority of trials did not list what phase they were in and only included a not applicable designation. Of the trials that did include their phase, the majority were in phase 4. Overwhelmingly, the most common place for trials were the United States. Turkey and Egypt were tied with the second most trials at 12. However, overall, North America had the most trials, followed by Europe and Asia. The most common injury type by far in the trials were anterior cruciate ligament or ACL injuries. Osteoarthritis and meniscus injuries were the next 2 most common. Total knee replacements were included in osteoarthritis since most of them are preceded by osteoarthritis. So why is this important? Like I mentioned earlier, more and more kids are participating in sports at earlier ages, and knee injuries are some of the most common injuries to occur. These injuries can lead to more issues later in life, so it is essential to help prevent primary or recurrent injuries. New diagnostic tests can help us give more accurate diagnoses earlier on in order to help prevent major knee injuries, whereas new rehab programs can help strengthen muscles around the knee joint in order to prevent injury. With trials occurring all around the world, we are constantly coming up with new ideas to help these injuries. This study helps summarize current clinical trials regarding knee injuries. This information can be useful to decide how to proceed regarding treatment and prevention of knee injuries. With the development of trials all around the world, we can find alternatives to help these patients. Due to the lack of pediatric trials, it is this study's recommendation that future trials be focused on pediatric interventions due to the increase of kids participating in sports. Thank you for your time today, and here are my references.